Well, lymphoma is a very complex group of diseases. Today we distinguish almost 100 different subtypes of lymphoma, and very often it is very difficult to distinguish them just based on morphology. So the first advance which is being made and which was presented with a lot of new data at the International Conference of Malignant Lymphoma in Lugano is the fact that more and more we use gene elaboration and no longer only the morphology to diagnose the different subtypes of lymphomas. The second problem is how to treat many of the most common lymphomas adequately, in the sense that some patients can be cured with a gentle treatment, some patients need a much more aggressive treatment, and we have to avoid treating too intensively the patients who do not need an aggressive treatment, because, for instance, in Hodgkin's lymphoma, after 15 years, second tumors and cardiovascular complications are more common than relapse. So we must avoid over-treating the patients. In the past, we were never able to know how to do that. We didn't know whether radiotherapy was necessary or not, and how intense should the treatment have been. Now, based on the PET technology, we are able to do that, and in that sense, the main novelty now is the fact that we can have the so-called PET-guided approach, which will help us in personalizing the treatment. And the third aspect is that there are a lot of new drugs, of new treatments, and mainly the immunotherapy has been shown with the checkpoint inhibitors, but also with the technology which has been devised to replace allogenic transplantation, that most probably, for instance, in Hodgkin lymphoma, adding checkpoint inhibitors to the standard treatment, we will be able in the near future to cure almost all patients. Well, I think that many Russian colleagues did not have the possibility to come to the Lugano conference, and the scope of this forum was to give them all the novelties, or most of the novelties which were presented in Lugano, so that they didn't have to travel there, but that they might remain updated, since in that field the progress is very rapid, and you need to be very well informed if you want to treat your patients adequately. And so the main scope was to give to our Russian colleagues the possibility to treat adequately their patients with lymphomas. Well, my expectation was to be able to transfer some of the knowledge that we have acquired during the conference to the participants of this big forum here in St. Petersburg. And on the other side, since I am not treating only patients with lymphoma, but also patients with solid tumors, I am very glad to be here, because I am sure that I can personally learn a lot also by attending other conferences during this meeting. Well, you know, lymphoma represent the fifth most common group of neoplastic diseases. and in the last 30 years, the incidence of lymphoma has doubled in the developed world. On the other side, many of the lymphoma subtypes are highly curable, and many of them are very common in young people. So, in general, most of the oncologists, of the hemato-oncologists, are very much interested in lymphoma because there are very many patients, very many young patients with that disease. And on the other side, it has to be stressed that lymphomas have always been, from the very beginning of the era of systemic treatment, the model on which new treatments have been evaluated. And even now, the new immunotherapeutic approaches have first been evaluated in lymphomas, and later on, the same modality has been then applied to solid tumors. Well, no, it is impossible today to solve many of the problems with which we are still confronted without having an international cooperation. I give you an example. For instance, I lead a group which is called the International Extranodal Lymphoma Study Group. In this group, we have institutions from 4 continents, more than 250 institutions. The reason being that each one of these lymphoma subtypes is rather rare, so that one institution alone cannot solve the problems. So if we put together all the cases of all institutions, then we can solve the problems of this specific type of lymphoma, which is very important because it is highly curable and very often seen in young people. Well, I think there are 2 advices. The first is to attend all the conferences and not to go to the city for touristic reasons. And the second is that to take advantage of the presence here of a lot of experts, to ask questions, and even after the presentation to go to them and to perhaps discuss some cases that they have and they are unable to treat with the experts who are here. So they must exploit the fact that there are many experts here to gain a lot of experience.